What was your brother's name? David?
David.
That's a good name, by the way.
Is that yours?
Yes.
Oh, okay. I didn't know.
Kind of biased.
Dr. Warwick.
Kind of biased. And so your brother was watching YouTube, sent you in here, took you a little bit to get in here.
Right.
And so he sent you in to see the SI guy, sacroiliac guy. That's me, by the way.
Sure.
And first treatment?
First treatment was good.
Helped.
It helped. I felt better than I did when I came in.
Then you had to drive a long way to get here, right?
Which I don't mind.
So right now we're releasing the sacrum. This joint, the SI joint, is about 3 to 4 inches long. Everyone's a little different, but I'm at the top and bottom portion of that whole joint. There's over 20 structures of ligaments on this joint here, on both sides. Most complaints, lower back, occur especially one side or the other is what people will feel, or both sometimes, where people will feel it across. It's usually because of an SI problem. Over 40 to 50% of the time, this is the area that's bothering people. People often call this a sciatica or SI. You were calling it S1 or something.
Yeah.
And sometimes they'll even call this my hip hurts. This is actually the hip area. So totally different. There's like 3 joints to be adjusted, even in this small area right through here.
Yeah. Yeah, that was, I said I'm sure it's still there, but with that shot, I'm not able to feel it.
So you did an injection first, right?
Yes.
How long ago was that again?
I'd say probably 2 weeks ago.
Okay. And then we went over your MI report. The thing that threw me off was it sounded like he was saying something was fractured. Is that right?
Yes.
Well, on that report, there's no fracture listed there.
He said what would be on the back side of my L5. Something was missing. Fractured, or not fractured, broken missing.
Broken?
To where it wasn't a lot, to where the L5 was falling back toward my back side.
Interesting.
And the way it felt, not knowing any different, just, trying to come to terms with it.
Doing okay?
Doing good.
Now I'm working on the QL muscle. This is one of the deep stabilizer muscles of the lower back out here. So that's what you see me working on. A lot of times when there's a lot of lower back pain, this muscle will start guarding, splinting, spasming in through there. Also associated with, are you ticklish, by the way?
A little bit.
Are you okay?
I'm okay.
Hamstrings. People sit a lot behind a desk. Number one thing that we see associated with lower back pain, tight hamstrings. So a lot of people driving a car, sit in traffic. These shorten up back here. So it can be really helpful. Helping change the muscles back there so they're not as tight. And you notice that I'm doing a traction. Can you feel it? You okay?
Yeah. It almost feels like right where you're at, just like it wants to pop.
Yep. Release the middle section.
Oh.
Breathe. Table will drop here. There it is. You good? That was a lot of work. I don't know who's working harder, you or me. Feel it right in there, don't you?
Yeah.
So right now I'm doing some pressure point on the muscles, right through the piriformis on him.
Again, I appreciate the detail and the time. Like I said, I've never had anybody take time like this.
I don't do anything different. I mean, after a while when I see you, I'm not telling you every little thing that I'm doing. Sometimes you're just telling me how the weekend went and who won the Super Bowl, who lost the Super Bowl.
I'm just saying, I mean, things before, but the last guy told me he took me as far as he could.
And maybe you did. That doesn't make the practitioners wrong. I mean, they gave you the best that they could with what they do. Every practitioner does the best they can. There's different styles, methods. Doesn't make them wrong, though. Let's have you lay on your back for me. Good job. You're going to be a little sore getting up.
Just saying, I appreciate this.
You're welcome. Lift your bottom half for me up. Nah, not that way. Other way. I got to bring this piece up.
Oh,
That's okay. Feet down. And we're distracting the hip on him. And that was only one session, right? You good?
yeah.
Good job. You're doing good. Lift your head for me. Back down. I'm gonna have you sit facing that way.
Get myself tightened up on that one.
Yeah. You'll get used to me doing the work. You'll relax into it more. You couldn't even touch your toes barely when you first came in here. Don't lean over too far, I'm gonna end up on the floor over there. You're probably feeling a little better, aren't you? Sore you will be. Hot shower, hot bath. Ice that area, especially when I'm working it like that, okay?
Okay.
Get up, move around, see how you feel. You did awesome. Good job.
I did good laying there.
Give you a ringer, huh? A little better. I want you to start walking.
Yeah, you know what? I've been doing that at night.
Get the app on your phone. Just the
Yeah.
steps. Kind of challenge yourself.
My wife and I do that. I got bad knees, so I didn't get shots in there. It was like before it started getting dark. We'd go and it was summer, it was nice out and that stuff. And it started getting dark and cold and rainy. And
It's getting lighter now.
I know. No, I like walking.
Good chat time with the wife, you know,
Yeah, I
and
like
you're
walking.
investing in your health too. But when you start making those little changes and taking care of
Well, I
yourself,
understand
even more.
weight is a big part of it about.
You know that. Do I look like a beanpole? But I worked out this morning. But you know, I mean, we all go up and down. We have challenges in life. You know, just do the best that you can and commit to taking care of yourself for 2019. Chiropractic's only a part of this to help you. Yes, when you do lose the weight, you're gonna feel better, way better, even without me. You know, because you're investing in you.
Right.
Good job.
All right. Thank
You happy? Absolutely.
Yeah, I appreciate it. Yeah, I feel like